Congestive heart failure is something that's often misunderstood. The bottom line is that congestive heart failure is when your heart is not able to keep up with the needs of your body. The risk of developing heart failure increases as you get older. In the United States, over the age of 40, there is a 20% lifetime risk of heart failure. So definitely more common as you get older. It is a big deal as well. If you are diagnosed with heart failure, the mortality at 5 years is nearly 50%. Preventative measures are always important. It's that way in pretty much every aspect of cardiology. It's one of the reasons that we harp on knowing your numbers and the healthy heart screenings and things like that. For the average American who does not have a strong family history of heart disease or does not have a genetic history of cardiomyopathy or congestive heart failure, these are the people that we're really going to worry about your cholesterol and your blood pressure in the development of coronary disease, because these things can certainly be precursors and set you up later for the development of heart failure. The biggest thing that you may notice is fatigue, shortness of breath. You can notice the congestive symptoms with swelling either in your legs, your abdomen, fluid around your lungs. You may be short of breath when you lie down, better when you sit up. Those type of things. If you start to notice that, or in general, if you start to notice that you're not able to do what you could do a couple of weeks ago, or you feel that something's just not right and that you're not able to get around the way that you were, that should be a tip-off that something may be going on. At that point, there's no reason to delay. Don't be silly about it. Just go ahead and get evaluated, get checked out, because with all of these things, there's certainly a benefit to being diagnosed early and getting started on treatment early. Congestive heart failure is a very serious thing. We mentioned that once you're diagnosed with heart failure, the mortality in 5 years is nearly 50%. So this is very, very serious. It's very important that you get started on medications early, and typically we try to titrate these medicines, the ones that can specifically help your long-term outlook. We try to titrate them quickly. If you are diagnosed with heart failure in the hospital, I would expect to be seen by your cardiologist or someone, some care provider within a week after discharge. Otherwise, if you're in an ambulatory setting or in the clinic, we're still going to be seeing you frequently on the front end as we get your medications titrated, and we do our best to get your symptoms controlled. So if you feel that there's a problem, if you notice that you're not able to do this week what you could do last week, or you're having more trouble with shortness of breath, fatigue, things like that, and feel that it may be related to your heart, the first thing is to talk to your doctor. As we mentioned, that these things are very serious conditions, but they can also be treated and they can be handled and managed. The best part is finding out early. That way we can treat it early and we can make a big difference long term.